All right, so thinking about type 2 diabetes as a disease of sick fat disease, it also points out that treating that sick fat can really help. Now, the main way we can do that is to reduce body weight. And that really has been a big shift in terms of medical management, where before the primary interest was fixing the blood sugar. Often the medicines we had at hand are weight-promoting drugs, which are good with the sugar, but have this flip side of being weight-promoting. So now we have some different interventions available, one being bariatric surgery for people with a body mass index over 35 with type 2 diabetes. And that's been really eye-opening, because when patients go through bariatric surgery, especially if they've had diabetes within, say, 5 to 6 years, diabetes typically goes into remission. And that's something that we weren't aware could happen before bariatric surgery. The thought was, at the time of diabetes, around half of the cells in the pancreas had died away and wouldn't come back, and diabetes would be always there, chronic and progressive. But what we saw when people lose 15, 20, 25% of their body weight with bariatric surgery, that pancreas can come back online, cells wake up, insulin production picks up, and our ability to store energy is better now. We also have new drugs like that you'll find out about or have heard about, called GLP-1 agonists, semaglutide, liraglutide, any with these agglutides. Anyway, there's different drugs on the market that are hormones that speak to the deep brain to lower body weight. And with those, we know that diabetes can be prevented and diabetes can be effectively treated. Now, we don't call it remission of diabetes with these drugs, because part of the definition of diabetes remission is being off all medical therapy that lowers blood sugars. And then we have other dietary interventions that lead to weight loss. One is called a meal replacement system, where people go down on a really low energy diet and lose substantial weight. And if they lose more than 15 kilograms, for those that had diabetes for less than 7 years, a very high chance of diabetes remission. And then there's other options like a ketogenic diet, and certainly needing to talk with your clinicians and doctors to talk about that before implementing it, because medical changes need to be made. So I'll give another talk on this called the Scoop on Diabetes Remission that I'll post elsewhere. And thanks for listening.
Thank you.